So I just had L5 S1 disc replacement. I had it yesterday morning. They had me up walking yesterday afternoon, evening time. Um, Same thing today, had me up walking around, the pain management and all that stuff. It's not so bad the first day because of all the stuff you have in your system. I would say the hardest thing right now is to get in and out of bed because you have to roll and then push yourself up. So doing that strains all those muscles in your stomach area. They went through the front into the back to do the surgery to replace the disc. Um, but overall, it's not so bad. The front hurts more than the back right now, but it's starting to kind of balance itself out. Um, but one night in the hospital, and then I get to go home, which is great. Um, so the biggest thing I can say to anybody is it's best to get up. The more you can move around, the better. Especially getting up and walking. Being in a chair, trying to sit up or stand up, is difficult. It's straining, but it's not so bad as trying to get in and out of bed if you don't have any assistance, because you have to use a rolling technique. Getting in is not so bad as getting out, but overall, I think it was a good surgery. I had a great doctor and great team. Um, so apparently, I'm doing better than most, which is always a great thing to hear. Um, but I know everybody deals with pain differently, and I have a higher pain tolerance than most, so I'm kind of used to it. But just all I can say is focus on something and try and focus on that to deal with the pain. But it's not overbearing. I've had hip replacements, I've had neck fusion, and honestly, this is probably the easiest one after the day after surgery. So I hope this helps anybody out there that's having this come up or is nervous. I was more nervous about this than I even was my neck surgery, just because where it's at and the pivotal point. I'll try and put some stuff up later on, like a week, 2, 3 weeks or so afterwards, so people can see. But I'm going home today. I'm going to take it very easy, and just try not to push too hard, because if you do, then it's going to take a lot longer and hurt a lot more. So hopefully this helps anybody that this is coming up to, that's going to have this procedure done. It was the L5 S1 disc replacement. So I hope this helps anybody with any questions. Thank you.